Good afternoon. Thank you for having me here today to speak with you and give you a preview of the training workshop on improving patient satisfaction. My name is Sarah Cleveland. So first, I'm just going to give you an overview of what I'm going to be presenting today. First, I'm going to go into the two areas of concern that I've chosen that are important not only for discussion, but also potential points of intervention to make the health information that we give our patients a little less confusing. Then I'm going to go into my working definition of health literacy, followed by key communication principles that our staff should know. Then I'm going to talk about recommended best practices that can be used in the everyday setting. And finally, I'm going to go through a small group exercise that I've developed so that our staff can practice what they've learned. So the two key areas of concern that I've chosen to speak about today are addressing language and cultural differences and encouraging patients to ask questions. You can see from this photo that in some cultures it's expected to shake hands with someone you're meeting for the first time, but in other cultures the norm is to bow. It is important to know how to make patients feel at home when you encounter them in the health setting. And the reason that both of these areas are issues in health literacy is that adherence to health recommendations, the ability to make healthy choices, and patient safety may be compromised if they're not part of the health experience. So, why is it important to address cultural differences, including language differences? Well, first, it lets the patients know that you recognize, but more importantly, respect their culture. You may also get the chance to emphasize the fact that the demands of health literacy in America are quite high, and they're not the only ones who may feel under-equipped in the healthcare setting. It's also important to give options like translation services over the phone to improve the patient's experience, and giving options will always improve their satisfaction. It also allows them to learn about their health in the way that's most ideal for them. And we are keeping the focus on the patient and asking how do they learn best. And finally, it makes the patients feel included in their decision-making process, safe because they're less fearful of communicating in the way that's not so natural for them, and it makes them feel more in control. And that is the entire goal, is to empower our patients. Now, it's also very important to encourage patients to ask questions, because in some cultures it is rude to question those in authority. Reassuring that this would not be the case in this context may make them feel more willing to be an active participant in the health process. It would also make them feel that their questions are valid, and it may lead to a fuller discussion as to why this treatment is important for them. Asking questions during an appointment reduces the likelihood that patients will need to call later to get their answers, and phone conversations take more time, and it may lower the quality of the health experience. Most importantly, poor medication adherence or future complications could be avoided simply by asking a question. So let's go back to the basics. My definition of health literacy is the level of one's ability to understand basic health information to make the right health decision for himself or herself. Examples of health literacy are filling out demographic, medical, and consent forms, and reading instructions for medication use. But health literacy is not just print literacy. It also includes oral literacy, which means listening and speaking. It could also include numeracy, which may be calculating how many pills you need to take in a day, or understanding your lab results. As you can see from this diagram, health literacy is influenced by general literacy skills, an individual's knowledge and experiences, and the health contexts. This can lead to certain health outcomes and costs, which would categorize health literacy as a social determinant of health. Here are some good communication principles and policies to be aware of. There was an executive order that stated for all health organizations receiving federal funding, there needs to be reasonable steps to provide meaningful access to programs for persons with limited English proficiency. One of the great ways that this order has been followed is through a national campaign called Think Cultural Health. This program promotes the culturally and linguistically appropriate service or class standards. They highlight the importance of providing language assistance and knowing your service population. And I recommend this resource. It is great for strategies, not only on a personal level, but on an organizational level to really improve health literacy. Many organizations will recommend the use of plain language when communicating with patients. This means that when you are speaking, you should avoid acronyms and medical jargon. And when there are written materials, make sure that they have a respectful tone, not condescending, and a design that utilizes white space, relevant visuals, headings, and subheadings to make it more reader-friendly. The teach-back method is also a great tool that involves asking the patient to repeat back to you what they've learned so you can ensure that your message was received correctly. Now let's talk about best practices to use in the healthcare setting. When you are addressing cultural differences, avoid an unwelcome atmosphere. My favorite way to create a welcoming atmosphere is to ask how to pronounce the patient's name. Even if I get it completely wrong, I will make them smile either way. It might also help to have signs in languages that are most spoken by your service population, or world maps hanging in the office. If you know what language they speak at home, you should greet them in that language. Using translation services for reading materials and offering interpretation services during conversations are also good ways to overcome language barriers. We must consider the ethical principle of autonomy, because unrecognized low health literacy may affect a patient's understanding of their rights. Autonomy is competence without coercion, and it's our job to ensure that this is a priority. When encouraging questions, never say, "Do you understand?" because the answer will almost always be yes, and never use, "Do you have any questions?" because the answer will almost always be no. Instead, you can use insistence by saying, "Please ask me something you've been wondering about." Make sure to use open-ended phrasing sometimes, like, "What are your questions?" Finally, preparing commonly asked questions can also help. You can say, for instance, "Many people ask me how to log in to the patient portal. Is that something you need me to answer?" Using these strategies can contribute to non-maleficence, doing no harm. Again, if we neglect to confirm understanding, poor health outcomes may result. So now I'm going to go through this small group exercise, and it's going to be a role play. The purpose of this is to practice ways to get patients to ask you questions. The rules are as follows. You must work in pairs. One person is going to be the patient and the other is going to be the health professional. When you are the health professional, you should use your real job title, and this will give you some practical experience, some words to use in your everyday life. You must use the scenarios provided and all 3 strategies that I'm going to go over again. Finally, when it's over, you will give and receive feedback. Your time frame for this exercise is 20 minutes, 10 minutes for each role. Now, the areas of concern, again, are to encourage patients to ask questions. That is our main goal here. But I also want you to keep in mind that we are also addressing language and cultural differences. Strategies to use, again, you need to use all 3. 1, insist on questions. 2, use open-ended phrasing. And 3, prepare commonly asked questions. You will need a pen and paper to take notes on how each strategy was used, because at the end of this exercise, we are going to come together and discuss what we've learned, different ways to say things so that you're not saying the same thing to each patient every day. Scenarios will be written on the slide for you, and the strategies and corresponding examples will be written on papers at your table to remind you throughout the exercise. So first, I want you to find a partner, introduce yourselves, and choose starting roles. Obviously, both of you will practice each role. Then read scenario number 1 and begin the role play. The role play is over only when the health professional gets the patient to ask 3 questions using all 3 strategies. So, if the patient has asked 3 questions, but only 2 of the strategies were used by the health professional, the role play is still not over. I need you to provide positive feedback to the health professional and then mention some areas to improve. Then you're going to switch roles and repeat steps 3 through 5 with scenario number 2. So here are the scenarios. I'm going to read them out loud for you. Scenario number 1, an elderly man and his wife walk into the office and he starts to fill out the registration paperwork. He only fills out his name and his date of birth and says, "That's enough." You gather that he can't understand the medical terminology on the form, so you need to help him fill out the remainder of the forms. Once you're done with that, you can move on to scenario 2, which is a middle-aged couple is finished with their appointment and the doctor has given the woman 2 new prescriptions to pick up. Neither of them speak very good English, so you want to ensure that she knows how to take her medications. I thank you so much for your time today, and I would love to take any questions that you have for me now. Here are my references.